Brain dead or alive? The controversial case of Jahi McMath. Jahi McMath was a vibrant 13-year-old girl living in Oakland, California. Like many teenagers, she had dreams and aspirations, but her daily life was increasingly overshadowed by a serious medical condition: severe sleep apnea. Sleep apnea is a disorder characterized by repeated interruptions in breathing during sleep. These interruptions, often caused by an obstruction in the airway, lead to fragmented sleep and poor overall rest, leaving sufferers fatigued and struggling to function during the day. For Jahi, the condition was particularly acute. Her mother, Nyla Winkfield, had long been concerned about her daughter's restless nights. Nyla noticed that Jahi would often wake up gasping for air, her breathing labored and uneven. These episodes would not only disrupt Jahi's sleep, but also her daily life, as she found herself increasingly tired, unable to concentrate at school, and missing out on activities she once enjoyed. The condition cast a shadow over her childhood, affecting not only her physical well-being but also her emotional and social life. Recognizing the toll that sleep apnea was taking on her daughter, Nyla sought medical advice. After a series of consultations with doctors, it became clear that Jahi's condition was too severe to be managed through non-surgical means. The medical team recommended a set of surgical procedures aimed at relieving the obstructions in Jahi's airway, which they believed were the root cause of her sleep apnea. The proposed surgery included a tonsillectomy, adenoidectomy, and uvulopalatinopharyngoplasty, procedures that, while invasive, were considered effective in treating severe cases of sleep apnea. The decision to move forward with surgery was not taken lightly. Nyla and Jahi's family weighed the risks and benefits, but ultimately they were reassured by the doctors that these were routine procedures, particularly for a young and otherwise healthy teenager like Jahi. The tonsillectomy and adenoidectomy would involve removing her tonsils and adenoids, common practices in pediatric surgeries aimed at reducing airway blockages. The uvulopalatinopharyngoplasty, a more complex procedure, would involve removing or reshaping tissues in the throat, including parts of the uvula, soft palate, and surrounding structures, to further clear Jahi's airway. The goal of these surgeries was clear: to improve Jahi's ability to breathe during sleep, thereby enhancing her overall quality of life. The family was hopeful that this intervention would bring relief, allowing Jahi to sleep soundly through the night and wake up refreshed, ready to embrace her teenage years with the energy and enthusiasm she had been missing. With these hopes in mind, Jahi was scheduled for surgery on December 9, 2013. As the day of the surgery approached, Jahi and her family prepared for what they believed would be a straightforward hospital stay. The night before, Jahi likely felt a mixture of nervousness and anticipation. Nervous about the surgery itself, but also looking forward to a future where she could sleep soundly and wake up feeling refreshed. Her mother, Nyla Winkfield, undoubtedly shared these feelings, trying to keep a brave face for her daughter while holding on to the hope that this surgery would improve Jahi's quality of life. On the morning of December 9th, Jahi was prepped for surgery. She was taken to the operating room, where a team of surgeons, anesthesiologists, and nurses awaited her. The operating room was a sterile, controlled environment, with every precaution taken to ensure the safety of the patient. Jahi was placed under general anesthesia, a process that involves rendering the patient unconscious and unable to feel pain during the procedure. Once the anesthesia took effect, the surgeons began their work. The surgery itself proceeded as planned, with no immediate complications. The tonsils and adenoids were removed, and the uvulopalatinopharyngoplasty was performed to remove excess tissue from the back of the throat, which was believed to be contributing to her sleep apnea. The surgical team worked meticulously, ensuring that all necessary steps were taken to minimize bleeding and reduce the risk of post-operative complications. By all accounts, the operation was a success from a technical standpoint. The surgeons completed the procedures within the expected time frame, and Jahi was moved to the recovery room to begin her post-operative care. In the recovery room, Jahi was closely monitored by medical staff as she began to wake up from the anesthesia. This period is critical in any surgery, as the patient transitions from being under the effects of anesthesia back to consciousness. Vital signs such as heart rate, blood pressure, and oxygen levels were carefully observed to ensure that Jahi was recovering appropriately. Initially, there were no signs of trouble. Jahi began to wake up, and her family, who had been anxiously waiting for news, were informed that the surgery had gone well. The doctors reassured them that everything had proceeded as expected and that Jahi would soon be ready to return home to continue her recovery. The relief that Nyla Winkfield and the rest of the family must have felt in that moment was palpable. They believed that the worst was over, and that Jahi was on the path to a healthier, more comfortable life. However, as the hours passed, the situation took a sudden and terrifying turn. What began as a seemingly routine post-operative period quickly devolved into a medical emergency. Jahi began to exhibit signs of distress not long after she woke up from the anesthesia. She complained of feeling uncomfortable and then started bleeding from her mouth and nose. At first, the bleeding seemed manageable, but it quickly escalated into a serious medical emergency. The medical staff attempted to stop the bleeding using various methods, including applying pressure and administering medications. Despite these efforts, the bleeding continued unabated, and Jahi's condition deteriorated rapidly. According to her family, she began coughing up blood, and the sheets on her hospital bed were soaked with it. This level of hemorrhaging is highly unusual for the type of surgery Jahi had undergone, and it signaled a grave problem. As Jahi lost more blood, her vital signs began to drop. She became pale and unresponsive, and her heart rate slowed. The medical team responded with emergency measures to stabilize her, but the situation spiraled out of control. Jahi's heart eventually stopped, leading to a cardiac arrest. The hospital staff worked frantically to resuscitate her, using CPR and other life-saving techniques. After several tense and agonizing minutes, they managed to restart her heart, but Jahi remained in a critical state. Her brain, deprived of oxygen during the cardiac arrest, had suffered severe damage. She was placed on a ventilator to assist with her breathing and was transferred to the intensive care unit, ICU, for further treatment. In the ICU, doctors conducted a series of tests to determine the extent of the brain damage. These tests included assessing her brainstem reflexes, which are critical indicators of brain function. The results were devastating. Jahi showed no signs of neurological activity. She did not respond to light, touch, or sound. Her pupils were fixed and dilated, and she lacked any gag or cough reflex, signs that her brainstem, the part of the brain responsible for basic life functions, was no longer working. On December 12, 2013, just 3 days after her surgery, the medical team officially reached a consensus. Jahi McMath was brain dead. This diagnosis is defined by the absence of all brain activity, including in the brainstem, and is considered legally equivalent to death. The hospital informed Jahi's family of this diagnosis and explained that according to the medical guidelines in California and many other states, once brain death is diagnosed, the patient is declared deceased, even if their heart continues to beat with the aid of machines. Hence, they plan to withdraw life support. However, Jahi's family, led by her mother, Nyla Winkfield, refused to accept the diagnosis. For Nyla, the concept of brain death was confusing and counterintuitive. She could see her daughter's chest rise and fall with the help of a ventilator. Her heart continued to beat, and her skin remained warm to the touch. Nyla and her family believed that as long as Jahi's body was functioning in any capacity, she was still alive. In the days following the brain death diagnosis, tensions between the hospital and Jahi's family grew. The hospital urged the family to come to terms with Jahi's condition and to allow the removal of life support. But the family, holding on to hope and faith, sought help from the legal system. Nyla Winkfield and her family, with the support of community activists and religious leaders, filed a petition with the Alameda County Superior Court. They requested a court order to prevent the hospital from removing Jahi from life support, arguing that more time was needed to evaluate her condition. The family's legal argument hinged on the belief that Jahi might still recover and that removing her from the ventilator would prematurely end her life. The case quickly garnered widespread media attention, drawing the eyes of the nation to the courtroom where Jahi's fate was being decided. The legal battle became a flashpoint for debates over the definition of death, patient rights, and the authority of medical professionals versus the wishes of a patient's family. During the court hearings, the hospital's attorneys presented evidence to support the brain death diagnosis. They cited the results of multiple neurological tests that showed no brain activity and argued that Jahi was, by all medical definitions, deceased. They also emphasized that the hospital was following standard protocols and that continuing life support in this situation was both medically unnecessary and ethically problematic. On the other side, Jahi's family presented a passionate argument based on their belief in her potential for recovery and their religious convictions. They brought in their own medical expert, Dr. Paul Byrne, a retired neonatologist and a longtime critic of brain death as a concept. Dr. Byrne testified that Jahi was not dead, according to his interpretation of the medical evidence, and suggested that she might still have some level of brain function. On December 20th, 2013, Judge Evelio Grillo of the Alameda County Superior Court issued a temporary restraining order, preventing the hospital from removing Jahi from life support. This decision was a significant victory for Jahi's family, as it allowed them more time to explore their options and to seek further medical opinions. The court ordered that an independent neurologist be brought in to evaluate Jahi's condition. The hospital complied, and a specialist from Stanford University was called in to perform the assessment. The results of this evaluation, however, confirmed the initial diagnosis: Jahi McMath was brain dead. Despite this confirmation, the court granted the family additional time to make arrangements. The family, still unwilling to accept the brain death diagnosis, began exploring the possibility of transferring Jahi to another facility where she could remain on life support. As the days passed, the tension between the hospital and the family continued to build. The hospital insisted that it was not ethically or legally appropriate to continue life support for a patient who had been declared brain dead. Meanwhile, Jahi's family, supported by public donations and legal advocates, sought out a facility that would be willing to take her in. Finally, after several weeks of intense negotiations, the hospital and Jahi's family reached an agreement. The hospital would allow Jahi to be transferred to a long-term care facility in New Jersey, a state where the laws regarding brain death were more accommodating to religious and personal beliefs. In January 2014, Jahi McMath was transferred to an undisclosed facility in New Jersey. Unlike the medical team in California, the staff at this facility were prepared to support Jahi's continued life on a ventilator and other forms of artificial life support, despite her brain death diagnosis. The transition to New Jersey marked a significant shift in Jahi's care. Her family, particularly her mother, Nyla Winkfield, remained deeply involved in her day-to-day care. They continued to believe that Jahi was alive and that she could potentially recover with time and proper care. The transfer yet did not mark the end of the legal battles or the public interest in Jahi's case. Instead, it raised further questions about the definition of death, the rights of families to challenge medical determinations, and the role of the state in such deeply personal and ethical decisions. Over the following months and years, Jahi's family released several videos and other materials that they believed showed signs of life and responsiveness. These included videos where Jahi appeared to move in response to commands, such as squeezing a hand or moving her foot. The family argued that these actions indicated that Jahi still had some level of consciousness or neurological function, challenging the brain death diagnosis. These claims were met with skepticism from the medical community. Most neurologists and bioethicists argued that the movements observed in Jahi were likely involuntary reflexes, which can sometimes occur in patients who are brain dead. They emphasized that brain death is a condition in which there is no possibility of recovery, as it involves the complete and irreversible loss of all brain function. Despite the medical community's position, the family's belief in Jahi's potential for recovery never wavered. They continued to care for her, providing her with the best possible environment, including physical therapy, nutritional support, and routine medical care. Jahi's situation became a focal point for a broader public debate about the nature of death, the rights of families to make medical decisions for their loved ones, and the role of the state and medical institutions in end-of-life care. Religious groups, particularly those with beliefs that differ from mainstream medical definitions of death, rallied around Jahi's case. They argued that the definition of death should not be dictated solely by medical criteria, but should also consider religious and cultural perspectives. For many of these supporters, Jahi represented a case where faith and hope could triumph over a medical system they viewed as too rigid and dismissive of individual beliefs. Conversely, medical professionals and bioethicists warned that allowing exceptions to the brain death standard could undermine the integrity of the medical system. They pointed out that the medical criteria for brain death are rigorous and well established, designed to prevent unnecessary suffering and to provide clear guidelines for end-of-life care. Allowing exceptions, they argued, could lead to situations where patients are kept on life support indefinitely, with no hope of recovery, potentially diverting resources from other patients who could benefit from them. As the years passed, Jahi's condition remained unchanged. She continued to require a ventilator to breathe and was fed through a feeding tube. Her body was meticulously cared for by her family and the medical staff at the New Jersey facility, who ensured that she was kept clean, well-nourished, and free from bed sores and other complications that can arise in patients who are bedridden for long periods. Throughout this time, Jahi's mother, Nyla Winkfield, became an outspoken advocate for her daughter, participating in interviews, public speaking engagements, and even writing a book about her experience. Nyla's unwavering belief in her daughter's life and potential for recovery became a powerful narrative that resonated with many people who felt that their own loved ones had been dismissed by the medical system. However, the reality of Jahi's situation remained grim. Despite the family's hopes and the support of their community, Jahi showed no signs of neurological recovery. The ventilator continued to do the work of her lungs, and her heart continued to beat, but there was no indication that her brain was capable of any voluntary control or awareness. After years of being in a medically unchanged state, something suddenly shifted. In June 2018, the situation grew dire as Jahi's family noticed signs of a new and alarming deterioration in her health. This time, it wasn't her brain that posed the danger, it was her liver. Jahi began to suffer from internal bleeding, a symptom of a severe liver failure that her body, already fragile, simply couldn't combat. Therefore, she passed away. On June 22, 2018, Jahi McMath's death was confirmed by the New Jersey facility where she had been receiving care. Jahi's family maintained that, up until this point, she had been alive in a meaningful sense, despite the brain death diagnosis. For them, her passing in 2018 was not a confirmation of the original brain death diagnosis, but rather a new and distinct event. The family's attorney, Christopher Dolan, released a statement acknowledging her death and reiterating the family's belief that Jahi had been alive all those years. This view contrasted sharply with the medical community's perspective. For most medical professionals, Jahi had been deceased since 2013, based on the criteria of brain death. Her passing in 2018, while significant, was seen as the end of a prolonged period during which her body had been artificially maintained without brain function. So where do you stand on this deeply divisive issue? Do you believe Jahi McMath was still alive in those years following her diagnosis? Or was her family's battle a fight against the inevitable? Was it right for them to hold on to hope? Or should they have trusted the medical professionals who declared her brain dead? These questions are not just about Jahi. They strike at the core of how we define life and death in modern medicine. I'd love to hear your thoughts in the comments below. Do you think faith and hope should guide decisions in such cases, or should we rely solely on medical science? If this story moved you or made you think, Please like this video and share it with others. Let's keep the conversation going. And don't forget to subscribe to stay updated on more stories that challenge our perspectives on life and justice.